Asthma is an inflammatory disorder of the airway, the tubes that take the air from your throat all the way through the main airway to the peripheral airway called the terminal bronchi. Sadly, it's a disease that is increasing in prevalence, which is of concern. It leads to symptoms of decreased airflow, so people feel that they can't breathe, particularly when they're trying to exert themselves. They can actually feel a tightness in the chest because the tubes actually constrict, and they often make inflammatory mucus that plugs up the airway, so air can't go in. Equally bad, air can't get out, so that they get air trapping. So it's like walking around with a deep breath all the time. So the inflammation is quite complex. There are different types of inflammation that can lead to different types of asthma, and that's why diagnostics are very, very important. The key to asthma management is working out the type of asthma you have and therefore tailoring treatment to match the type of asthma or inflammation you have. The airway, people forget, begins at the nose and it finishes here where the terminal bronchi are. Nature doesn't draw a line at the level of the voice box and say, this is just rhinitis and this is just asthma. If you're going to have inflammation in your airway, then you're going to have it here, here, and here. And for that reason, patients with asthma often have upper airway disease with rhinitis or rhinosinusitis, and certainly patients with severe asthma, if you look at their radiology or images of the sinuses, have almost 100% chronic rhinosinusitis. The key diagnostic is to show airway variability in terms of airflow. So what diagnostic asthma is demonstrating that the airflow is at a certain number at a particular time of day and it changes later on. And when someone has asthma symptoms, that airflow decreases further. That is called airway reversibility. Once that is confirmed along with the clinical history, the next step is to try and understand what type of asthma they have. They could have allergic asthma or what we call late onset asthma, which is very different immunological pathways or mechanisms, and the key expertise is trying to understand the phenotype or type of asthma and the immunological mechanism or endotype that drives that. So once we understand those factors, we can then tailor the treatment to match the patient, from basic inhalers to much more complex intervention with these amazing drugs now that we use called biologics. The key to achieving excellent outcomes is getting the diagnosis right, so confirming that they have asthma, but importantly confirming the type of asthma they have, and this is where the diagnostics become critical. Once we know the type of asthma they have, and we can then also investigate the severity of asthma they have for measuring inflammation, lung function, and also any comorbidities that go with asthma, we can match the patient to the right treatment.